This is not marketing. No! Prepare for learning.
Good evening, everyone. Thank you for joining us. My name is Luke Ferrari. I am the district manager with BioT Medical. It's my pleasure to be joined by Dr. Asher Milgram and Dr. Alice Pien from AMA Regenerative Medicine. I'm excited to be here joined by the doctors this evening to discuss the benefits of BHRT, health, and hormones in your 30s, 40s, and beyond. You know, I have known these two medical professionals for a number of years. I think it's been about 5 years. And I will tell you that they are some of my favorite providers to work with, as I'm constantly learning something new. They have such a unique and beautiful practice and just way about them in general that I always enjoy spending time with them. It's really fascinating. I really feel like they're always on the cutting edge of science and medicine and technology. And so without further ado, I will pass it over to Dr. Milgram and Dr. Pien to talk to us about the importance of hormones.
Hi, thank you, Ty. I'm Dr. Alice Pien. I'm so glad you can spend the evening with us to learn about your hormones. Some of you have been with us for many years, 10, 15, 20. We sort of have been aging, growing old together. So now it's not only our skin is aging, which in AMA Skincare we have the solution, but our body is aging. Our hormonal glands are aging. So it is important that we balance and optimize these hormones in our body because it affects every aspect of our lives. It affects our sleep, our mood, our memories, our bones, our skin, our weight gain, weight loss. So you will learn and hear from Dr. Milgram the science of aging gracefully, healthy, and fully.
Okay, here we go. So first I want to introduce BioT, why we're actually here with BioT. I'm not going to call her Dr. Pien, I'm just going to call her Alice. In case you're wondering, we're at home right now. And in case you don't know, we're married. So here at home, she's Alice and the boss. And so let me introduce BioT. Alice and I, long time ago, decided that we wanted to introduce biological identical hormone replacement therapy in our practice. Over 10 years, we've been looking to do it. But at that time, it required of us as practitioners a tremendous amount of skill to dose people properly, to figure out, to assess exactly where they are hormonally, to bring all the variables in that contribute to the health of your hormone landscape. We figured that unless we were doing it every day, developing that level of skill and art in diagnosing, assessing, and then dosing people correctly, that we really were not prepared to do that. It was too much work, and unless we were doing it all day long, we would never get good enough at it. So we put off doing it for many years. And then BioT showed up. They are really leaders in the field, both in the science and in the research, and in working with amazing compounding pharmacies to be sure that the hormones are identical and properly made. And also, they have amassed an enormous database of patients who are using this technology, the pelleting, the putting of these hormones under the skin. Hundreds of thousands of patients, millions and millions of doses, and they developed an artificial intelligence system to analyze all this data. So when a new patient comes into the system, after the blood work is done, and we collect their numbers from the lab and the questionnaires they have to fill out, all that data goes into the system, and the artificial intelligence system, with that huge database backing it up, does all the figuring, does all the dosing. And we don't have to figure it out. We don't have to be that good at it. And the system now has been refined over many, many years. And if you have more questions about the history of BioT, Luke is on board, and he can add. No, his name is Luke, actually. And no, it says Ty, but his name is Luke. And you can ask him about the history of BioT. So anyhow, having said that, that's why we're working with BioT. That's why you see their logo all over the place. because they are the leaders in the field, and without them, we couldn't be doing this. All right, so straight on to this presentation. We should be in and out in 20 minutes, by the way. And if you wanted to really take a deep dive into the science, we could be in here for days. And so I'm going to follow this slideshow. And no question, something as small as a little tiny pellet under your skin can make a huge difference in your life. All right, anyhow, as I'm sure we all know from the jokes about it, certainly if hormones are not right, nothing in our bodies work right. And we kind of know that. And it's very important that not just the individual hormones have the correct level, but they have to be in the correct levels amongst themselves in relationship to each other. So this is an issue not of an individual hormone level, but the entire landscape of whether or not your hormones are optimized for you and in relation to each other. All right, so what do we need to know, and who can you believe, and what do we potentially do? I already talked about BioT, and they are truly the source of this technology and the system that we use in our office. So in case you don't know, hormones are chemical messengers that your glands send out, and virtually every organ and every cell in your body has receptors for hormones, and they receive information and instructions from the hormones that your glands release, and it changes your physiology in every conceivable way. So the question of whether or not we age because we lose our hormones, or do we lose our hormones and then cause the aging, is the chicken and egg question. The bottom line, and without getting into the science of it, if your hormones today are not like a 50, 60, 70-year-old person, but if they're optimized to be like that of a 30-year-old, when you were 30 years old, then you would function like a 30-year-old. So we'll get there. So how do you feel, of course? Are you feeling energized and vital, or frustrated and tired? There's 1,000 slides for that, and we're just going to skip right on through them. So the kind of symptoms that people experience when their hormones are off, they're all listed here, and I imagine that a lot of you are familiar with these. The extreme fatigue, the mood swings, the anxiety, tension and irritability. For me, it was a major lack of ability to concentrate for long periods of time. Over my years as a scientist, I would consume 5, 6 articles a day, just suck them up. And in the last few years, I just didn't have the mental acuity, the mental strength, vitality to concentrate for long periods of time. I was really losing it. Lack of sleep, of course, memory loss. If you ask my kids, I have no memory anyhow, but certainly your hormones have a big effect on that. Depression, lack of focus, brain fog, hot flashes. You can read the list here. Of course, what people often complain about is the aesthetic issues of loss of hormones, the weight gain, and the laxity in your skin, the sagging of the skin. All that is affected deeply by your hormones. And last but not least on this list, decreased sex drive and performance. So the BioT method uses, compounded bioidentical hormones of both testosterone, estrogen, and thyroid. And that's the basis of the system. There are other elements that you need to consider. And of course, for women after menopause, progesterone is going to be an issue. And vitamin D and a variety of other nutritional supplements that all affect the hormonal landscape. And if you are wondering, vitamin D, they call it a vitamin, it's actually a hormone. Again, these are all the science has changed a lot since we were in medical school 30 years ago. All right, now we're talking about not just menopause for women, but andropause for men. Men, of course, are losing testosterone from about 25 years and on. You start losing testosterone. It's just a very gradual decrease for men, and therefore, oftentimes men don't realize they're in a state of tremendous loss of testosterone until they're deep in it, because they didn't feel it coming on. It was so slow. And the stats are right here. 20% of males over 50. It's very common with diabetes, high blood pressure, sleep apnea, other chronic conditions, and it's associated with many other nasty things like early on heart disease, and oftentimes, as I mentioned, the lack of testosterone is really undiagnosed. Okay. So I kind of wonder, why this testosterone picture here, he's holding his phone the way he is, but maybe it's supposed to be subliminal. Anyhow, that's my intent for humor. All right. So, all right. So providing having proper testosterone in your body protects your bones, your brain, breasts, heart, of course, your relationships. Both men and women have testosterone. Guys have lots of it, 20 times more than women. And again, here are the stats that you lose 1 to 3% of it every year, and women, lose up to 50% a year. And they start with a little bit to begin with. Now, I'm going to say something very controversial here, but the data on it and the science on it is 100% accurate. For women who are listening to this, osteoporosis is 100% preventable. And all the nasty drugs they want to give you as your bones fall apart is completely unnecessary. If you had the proper amount of testosterone in your body that you had when you were 25 years old, your bones would be fine, and to 109 years old. So we can get more into that with questions and answers later. All right, now here's some scary stuff. All right, so we're looking here at disease states with lack of testosterone. So if you look down at the bottom of the slide here, you can see that with very low testosterone, erectile dysfunction and depression shows up, and then with slightly higher levels of it, under 400, coronary heart rate disease goes way up for men in particular here, fatigue and libido, etc., all the way up to the top, where we're looking at testosterone levels of 900. That if you have over 900, then your incidence of Alzheimer's is much, much lower than if you have under 900. So again, these are things you can look up, and these slides that we can make available to you if you want to look at them later. The bottom line is, when you're young and you had high testosterone, none of these conditions showed up for young people. And as you age and your hormones begin to levels go down, these diseases show up. Now, it's not necessarily causative, but it's definitely a corollary. It's a contributing effect. A low testosterone in these conditions. So the positive effects, of course, of testosterone: increase energy, vitality, zest for life, improve feeling, overall wellness, depression relief, anxiety relief, improve cognitive clarity. That's what I was talking about, and my ability to absorb new science data. Improve memory. That's a huge thing. It's been a huge thing for me. I was having a really hard time remembering names, and sometimes words wouldn't come into my sentences the same alacrity and smoothness as they used to. And getting my hormones right has made an enormous effect on my memory and my verbal acuity. Improve focus, libido, performance. Okay, and here is the stuff that people have usually wrong on the right side of the screen here. It actually protects breast health and prostate health and brain and heart and bone and muscle strength, of course, and reduced body fat. So we'll talk about the ones in the top coming up soon, because there is a lot of misconception out there that if you do hormone replacement therapy as you age, it actually increases the incidence of breast cancer and prostate cancer and a variety of other scary things. And that is old data, and it's wrong, and we'll get to it in a minute. Okay, so we talked about men. Now here's the menopause for women. 3,500 women enter menopause every single day. Fortunately, I only live with one of them. Symptoms can begin 15 years earlier than the actual sensation of your menses. So if you are still years away and you're wondering about some of these symptoms that are showing up, and you're thinking, can't be menopause because I'm only 40, or 38, well, it could be, and therefore it's worth checking out. And again, most women are affected in ways that they are not even aware of. And this last one here, since we've been doing these procedures in our office, I can tell you this last statement is very true. Women do not ever get over or get through menopause. It's there all the time, and you need to supplement properly in order to deal with it. All right, more news here. Before menopause, 1 in 7 women die from heart disease. That's here in the United States. After menopause, it's 1 in 3. So it's twice as many. So obviously, this is something that you all need to be cognizant, both men and women. You know, our lives without our women are, well, not happy. And these stats are real, and bioidentical hormone replacement can reverse this. Okay, let's talk about estrogen for a minute. Both men and women have it, large amounts in women, very small in men. It affects over 400 different physiological functions in our body. And of course, the things that we're familiar with, you know, the hot flashes, the bone density, again, helping memory, and the collagen in your skin. We've been treating skin with these very sophisticated lasers now for 25 years. And for sure, women who are on bioidentical hormone replacement respond better to the protocols we've developed over the last 25 years than women whose hormones are low. And of course, the happy hormones, serotonin and dopamine, are very affected by these hormones as well. Positive effects, okay? Again, the hot flashes, the skin collagen, bone density, bone strength, protection, both for breast, brain, and heart. And it actually lowers your cholesterol. Again, that's one of the misconceptions that people have, that if you're doing hormone replacement, your cholesterol goes crazy. That's not true. It actually helps that. And the other mentioned things that we just mentioned. Okay, so the therapy itself, how does it work? Generally speaking, out there, if you've been thinking about doing it or you have been doing it, there's a decision you have to make, and you have to understand the data behind them. There are synthetic hormones and there are bioidentical hormones. The synthetic hormones, you know, you can get them either pills, patches, or shots. And I'm one of those guys that was injecting synthetic testosterone, and my testosterone really bottomed out 10 years ago, and it drove me crazy. We'll talk about that later. And then the bioidentical side, there are pills, patches, creams, and pellets. And pellets is really the system that works best, and we'll get to that in a minute. All right, so again, some more. I need to disabuse you of a lot of the rumors out there that came from a flawed study back in the early 2002. And what they found and what they produced out there is that doing hormone replacement therapy, okay, again, it was not bioidentical. These were synthetic hormones, would increase strokes by 41%, heart attacks by nearly 30%, breast cancer by 26%, and major issues of blood clots. I'm sure you're familiar, you know, with that rumor as well, and then a huge increase in Alzheimer's. Now, this was a terribly flawed study, and at the end of this talk, there's a lot of articles about that. You can access them if you want and read them. And this study, again, was based on synthetic hormone replacement. Patches, I'm not going to spend much time on this because, again, it's not something that we advocate. They're problematic because they move around. You have to replace them a lot. Not everyone can absorb hormones through the skin, and therefore it's difficult to get reproducible and reliable results with the patches because of that. And then, of course, the creams. The issue with the creams, and I tried the testosterone cream here as well, is that it gets everywhere. And, you know, it's not only on my skin, but it's on my fingers, and then on the faucets, and then, you know, on my pens if I didn't wash my hands. And someone else in the house could touch that same faucet or pick up the pen and start absorbing the testosterone that's supposed to be in me. Every now and then we have women coming into our office with unusual hair growth, male pattern hair growth. And we do a little sleuthing and find out that their husband or their boyfriend is using testosterone creams. It got on them, and voila, they have the hair. So anyhow, we don't advocate for the creams either, and some of you obviously are likely have tried it. Injectables, I mentioned testosterone is injected. Again, it's a synthetic. And the problem with the creams, the problem with the patches, and the problem with the injections is that you are superimposing on your body an unnatural rhythm of high and low levels of the hormones, which is like being on a roller coaster and can most definitely drive you crazy. Okay, so now on to the bioidentical hormone pellets that we use with the BioT system. Here in the picture, you can see those little tiny like grains of rice in the palm of the hand here. That's how large they are. They're tiny. Now they are completely natural. They're plant-derived. They are molecularly identical to the hormones that your body makes and has been making since you were, actually before you were born, you were making them. And so it's exactly the same molecular structure. In a pellet form, they last a lot longer than any other way of putting this in your body. And it is incredibly well studied. Okay, I'm not going to get too much into the history, but you should know that pellets have been used for over 80 years and studied many times. I mean, literally hundreds of studies, both here in the US and in Europe. And so the whole idea of putting hormones under your skin is nothing new. It's tried and true and well received. Let's go on. So here's some of that data. You know, back in 1939, it was developed. And these are the articles that you can access later and read about them. Here's what I was talking about in terms of an unnatural rhythm of high and low hormones. When you do the pelleting, you're that green line. You are consistent and constant throughout the day and night. When you do the other methods, you're up and down, and yes, it will drive you crazy, and it'll drive the people in your life crazy too, because they have to go on the roller coaster with you. The way the pellets work, by the way, is brilliant. They're inserted under your skin, and your body will develop a venous plexus around the pellets. It takes a few weeks for them to do that, but then your own body, through this venous plexus, will draw out of the pellets according to what your body needs, just as if your organs were making the hormones as they did when you were younger. Your body will have them available to you depending on your need. So of course that depends a lot on your overall metabolic demands. So it's perfect, and you never have to think about it. You just feel good all the time. All right. Again, hundreds and hundreds of studies, no roller coaster effect, very low side effects from any of this. We mentioned already that it increases bone density. Lowers the risk of breast cancer, ovarian cancer, testicular cancer, and prostate cancer. There's no increase of issues with blood clots or heart attacks or strokes. Again, these are some of the things that came up in those earlier studies that were simply erroneous. And
because they were using synthetic.
They were using synthetic. It's not just, by the way, that it was synthetic. The actual way of administering the hormones makes a difference too. Imagine if your body is used to having a consistent amount of hormones around and suddenly it's up and down and crazy. Yes, that also has a negative effect on your overall health, including cancer and heart and other things. So it's that it's bioidentical, and pelleting itself, making it available upon demand, is the way your body was designed to have them. And when it has them that way, everything is happier and your system's less tendency to get sick and develop other diseases. Okay, breast health, we talked about that a little bit. I'll just, again, it's a big issue, so we'll go over these points here. Testosterone delivered by pellets does not increase breast cancer risks, unlike oral synthetic testosterones. Testosterone implants show less stimulation of breast tissue, and the estradiol implants do not increase the risk of breast cancer. Again, all these things have been studied in detail, and you can see at the bottom some of the articles that you can access to read them yourself.
Even breast cancers.
I'm sorry, say loudly?
Even breast cancer survivors.
Right.
They've done studies and show that having estradiol, estrogen pellets does not increase their chances of getting breast cancer again.
And that's a slide coming up. I think may even be the next one. Here it is. Wow, you're like a prophet. All right, anyhow, so hormone replacement therapy after diagnosis of breast cancer. That's a question that comes up in our clinic all the time. So here's some of the studies. So nearly 3,000 women ages 35 to 74 with breast cancer, okay? And you'll see that breast cancer recurrence was 17 out of 1,000, okay, for women who used HRT, hormone replacement therapy, and it was 30, so twice as much. And for women who were not using hormone replacement therapy. So obviously, if you've had breast cancer, one of the best things you can do for yourself is get on bioidentical hormone replacement therapy, because the recurrence of the cancer is a lot less if you are properly optimized with bioidentical hormones. And the same goes with the mortality rates, 3 times higher for those who are not using hormone replacement therapy. And the mortality rates, again, at the bottom, you can see the rates again are double if you're not. So bottom line is hormone replacement therapy, a good idea. Okay, bone health. I mentioned earlier about osteoporosis. I'll just say it again. Osteoporosis is 100% avoidable. And if your hormones are right, your bones will be strong. Okay, and arthritis. Okay, so as we get older, right, joints hurt. And these stats, again, are well established. 10% of men, 18% of women 60 years and older have osteoarthritis. Of course, more so with women than men because you start with less testosterone to begin with. And both estrogen and testosterone will help your joints and rebuild your cartilage, and not only can prevent it, but can possibly, and again, I have to say possibly because the FDA hasn't allowed us to say otherwise, but it can reverse the development of arthritic tissues. Okay, brain health. As Woody Allen said, my brain is my second favorite organ, but given that it's number 2, you do want to take care of it. So women get Alzheimer's 8 to 1 times over men. And women on estrogen, okay, are 50% less likely to develop Alzheimer's, and men with low testosterone are 3 times more likely to develop Alzheimer's. Bottom line, biological hormone replacement, a good thing for your brain. Heart. Well, let's go over these stats together. Estrogen replacement with pellets has a positive effect on body fat in postmenopausal women, as well as improved lipid parameters. So you're talking about your LDL and your HDL and your triglycerides. All these things improve when you're doing biological hormone replacement, bioidentical, okay? And the same goes with testosterone. So bottom line is, not only will you have better, leaner, more stronger, more muscular body, but internally your lipid profile improve. And of course, that is incredibly important for your cardiovascular health. Again, here are the stats again on LDL, HDL, and triglycerides. Bottom line is you will improve with biologically identical hormone replacement. All right, the risk of pellets. All right, so when these pellets get inserted, the most common thing that in this, primarily for women, is a little bit of fluid retention. Now, we've done in the last year, hundreds of patients. We haven't seen that yet, but it is the most common, complaint that might occur, and that will resolve after a few weeks as your body gets used to it. The swellings in the hand and feet, particularly in hot, humid environments. We don't have that issue so much here in Southern California. Breast tenderness, we do see that. Nipple sensitivity, and again, there are adjustments that your body has to make, and also there are adjustments that can be made with some of the nutraceuticals that go along with the pellets in order to ameliorate that. Some spotting and bleeding. This is particularly for postmenopausal women, and that gets balanced properly with progesterone. All these things are known. The system knows exactly how to dose you in case it shows up. There may be some adjustments that go along with the first time you do this, the pelleting. Pellet extrusion. Sometimes, and this is primarily for men, we've only seen it with men. In fact, we've only seen it with one particular patient, and where a pellet can actually get extruded and has to be reinserted into under the skin. Breakouts for acne, again, we haven't seen it, but it does occasionally occur. Reduction in testicular size. After long use of this, prolonged use, not right away, but after you've done this maybe for a couple, 3 years, you might see a little bit of that. We haven't seen it yet because we haven't been doing it that long. And talking to physicians and colleagues of ours who've been doing this a lot longer, it's rare, and men, it doesn't bother men, but they do notice it. Now, the reduction in sperm count, sometimes that's a good thing. And in fact, there are younger men who use this system as a method of birth control. All right. Let's see. Bottom line is the system works. This is the last slide. I hope you have some questions. It's not a one-size-fits-all approach. And again, that's part of the beauty of the system. We get your data, you answer the questions, we take your blood measurements, etc., your panels, we insert them, submit them into the system, and you get a customized approach, dosing that's customized for you. And that first and second time when you do these dosing, if any adjustments need to be made, they are made, and any adjustments, by the way, you don't have to pay for. So far, the many patients we've done, the system has nailed the proper dose the very first time. So we have a lot of confidence in the system. So we would be honored to take care of you. Last thing about the cost, you might be wondering. For women, the Peloton costs $500. For men, it costs $900 because they need a lot more of that stuff put in them, all that testosterone that they need to be revitalized.
It's every 3 to 4 months.
Every 3 to 4 months for men, and for women, and 2 to 3 for men.
5 to 6.
5 to 6 for men?
Yeah.
Oh, well, she does it. I just talk about it. At any rate, like I said, I wish I had done this when I was 40. I'm in my 60s now, and it's made an enormous difference. So, Luke, why don't you jump back in there and tell us what to do next?
Yeah, excellent presentation, Dr. Milgram. That was all very well said and very clear. So I'm sure everyone enjoyed it. So we do have a very interactive group. So we do have a few questions. I know this was covered, I think, before it was mentioned, but can you just mention again the difference between bioidentical and what bioidentical is made of?
Okay, bioidentical hormones are made from plants. Now, in general, most of them are actually made from a certain species of yams. And they are manipulated such that they are identical in molecular structure to the hormones your body makes itself. This is very different than the artificial hormones that are still used prevalently out there. I mean, they're still prescribed. For instance, right. So for women, the estrogen that's used for women is actually derived from pregnant horse urine. And it's not the same as the estrogen that human beings make. So that's the answer. It's plant-based and molecularly identical to the hormones that your body makes.
Excellent. Next is HRT covered by major insurance?
Okay. This is the political answer. Anytime you're talking about something which is bioidentical, meaning it occurs in nature, it cannot be patented, right? These hormones exist in nature, they exist in you, and therefore any molecule, even if it's made from a yam that's identical to what already exists in nature, cannot be patented or owned by any company or any pharmaceutical company. So guess what? If there's no patent and no control, there's no money in it. And if there's no money in it, insurance isn't going to cover it. So biologically identical hormone replacement is not covered by insurance. It is well worth it. And it's well worth putting your money into your own body that way, so you get these incredible results of youth and vitality according to what nature prescribed and designed for you.
Excellent. Next question. What is the typical cost and duration of the treatment and maintenance? How is it monitored?
Great. It's monitored by blood levels and by your own symptomology. So again, for women, the cost is $500 per pelleting. Dr. Pien is the one who actually inserts the pellets, and of course it's done in a completely sterile environment, sterile field. It only takes about 10-15 minutes to insert these things under your skin, and you don't feel it at all. I mean, I've had it done now a number of times, and I don't feel it when they're inserted. Inserting it in men is a little bit more, a little tougher to do than women, because women have that thicker layer of lipids, fat under the skin. Men are a lot more gristly back there on their butts, and so it's a little bit more forceful to put them in. And even so, I don't feel a thing, and none of our patients do. Again, $500 for women and $900 for men. and you will need it, 3 to 4 times a year, depending on your metabolic usage and demand. If you're a marathon runner, then you're going to need more because you're burning that stuff up. If you're a couch potato, which reminds me of a joke, you'll need it less. Here's the joke. Women are a lot more sensitive to this because they are simply more into their bodies and much more aware of their bodies and their physiology and their hormone levels than men are, because they go through this for, their cycles for many years. And so they're much more aware of these things and are much more likely to take care of it. So what happens when a woman gets pelleted and she's like a 30-year-old once again, and she comes home and she is superwoman. She's superwoman, and she comes home to Captain Couch Potato. If you're thinking about doing this, it's a good idea to do it together as a couple.
Yes.
It's well worth doing it.
Absolutely agreed. Now, we have a couple of people asking a very similar question. So can you talk about how one would determine if they are a good candidate? Specifically, is lab work needed?
Lab work is essential, needed, and critical. We need to know what your hormone levels, what your profile is, your landscape is. That data, again, is inserted into this enormous database with the artificial intelligence system that's analyzing it. In order to get the levels right, we need to know where you're starting from. It's the old adage, if you have a map open in front of you and you want to get to the castle on the hill, you can never get there unless you know where you're starting from on the map. So you need a starting point, and your labs are very important in that. Now, the other information comes from your own assessment of your symptoms. And so there's a questionnaire that you fill out where you're talking about your quality of sleep, your memory, your moods. It's a very extensive questionnaire. All those elements are important in assessing. And again, if it was up to just Alice and myself and our nurses, we wouldn't get it right. But there's so much data now, and analyzing and assessing how you answer these questions and what your blood levels are to get the proper dosing for you to make this enormous difference in your life.
Excellent. How quickly do patients feel a difference? How quickly do they work?
So you recall earlier in the talk, I mentioned that your body creates a venous plexus around these pellets after they're inserted. It takes about a month for that venous plexus to work its magic and build that nest of veins and around the pellets. And therefore, the assessment really begins at about a month, where we're asking you, what are your symptoms, how you're feeling, how's your memory, how's your sleep? And then if we find at that point between week 4 and 6 that symptomologically speaking, things don't seem to be right, we do another blood analysis and look at it all over again and see if you need some adjustments in your dosing. And by the way, if you do, that extra treatment and the extra dosing is on the house. You don't have to pay for that.
Which would you say, is that pretty rare, Dr. Milgram, that patients need to be?
I think we've only done it once. We've had one person that needed an assessment.
Yeah, most of the dosing are pretty accurate.
I'm impressed. I mean, like I said, we avoided doing this for years because it was just too complicated to figure out how to dose somebody. But this system is amazing. So excellent. All the patients we've done, we've only had one that needed to come back in for an adjustment.
Excellent. Yeah, many questions streaming in. Can you feel the pellets inside you? How often do you need to get them done?
Okay, so when they're inserted, you would feel them that first few days because it's a little swollen back there. And there's a little tiny incision, and it's really very small, but it's a little sensitive. And you're wearing a little Band-Aid, so you can feel them there. It's a little sore. But after the first few days, that soreness goes away, and you're not aware that they're in there at all. And again, if you're skinny, you're likely to feel it more than if you're a little bit plump. Again, that's not a man-woman thing, because we got some plump guys coming in for this too, and they can't feel it either. But the skinny ones, the real muscular, skinny butts, they're more likely to feel it there than someone who's plumper. What was the second part of the question, Luke?
I think you covered it.
Oh, when do you have to replace it?
How
Okay,
often,
so again, it depends on the rate that you're using it, and it's kind of difficult to know exactly when the right time to put your next pelleting in. I'll mention my own experience that I was doing great. I wasn't thinking about it. I was waking up every morning going, oh my God, how come I didn't do this when I was 40? And then 1 week I just tanked out because I waited too long. And when we looked at my chart, we realized, oh my God, I'm a whole month late. Generally, we have an idea of when men need to do it and when women need to do it. And I was so busy in the office that I didn't pay attention, and I was a month late. And wow, my energy just plummeted. So we have an idea when it should be, but really it will depend on how sensitive you are to your own energy levels, to all those different things that we mentioned that are improved when you do this. And if you feel, oh my God, I'm sliding a little bit, give us a call. We'll look at the chart and see if we should go in there and head it off, head it off at the pass before you tank out like I did. Once you get it right the first time, okay, then you know pretty much, okay, from here on out, I needed X amount of months, what the dosing should be and what intervals you need. It's that first one we need to pay close attention.
It's interesting, Dr. Milgram. I'm reminded of the old adage, the shoemaker's children have no shoes. Sometimes when we're closest to something, we don't always focus on ourselves. So that sounds like a situation where you put yourself as a patient last.
Yeah. When you do this, there's going to be a whole new line of jokes.
Right.
About oh, have you had your pellets this morning, or
Right.
whatever. So it's comical and interesting. Life is really interesting, especially if you have some control over what's going on.
Right.
So I wish that on all of you, that you have that kind of control over your moods and your energy and your mental acuity and all those things, because you are now in control of your hormone landscape.
Agreed.
Next question.
So we have got questions streaming in, so I will jump into the next one. Please explain the process of inserting the pellets under the skin.
Well, let me turn that over to Alice, because she's the one who does it.
So it's very simple. The procedure itself, it's about 15, 20 minutes. We find a fat pad, a nice fatty area on your tush, and we sterilize the area. We're gonna numb you first with some lidocaine. So the only discomfort you'll feel from this whole procedure, it's truly just that little needle poke. So once you're all numbed up, we'll make a very tiny little incision, maybe a 1/4 inch slit, and then that's how we put in a little trocar, which is an instrument that helps us place the rice grain-like pellet in you. And once that's in, we put the bandage on, and so then you're done. The only thing we recommend you not to do afterwards is no hot tub, no soaking in bathtub, just so that we can keep the tape on your tush for the next 3 to 5 days.
Now, when she mentions tush, it's not where you're sitting. So it's like 2 inches below your belt line. So it doesn't interfere with sitting and moving around the office or anything else. Next question.
Yeah, that's an excellent point. Are there any medications that don't work well with HRT? Any contraindications in terms of medications?
Well, I hate to say that, in the United States, people over 50 are taking way too many medications. I mean, we look at the list of meds that our patients are on, and one of the most important things we can educate our patients about is how to wean themselves off these pharmaceuticals, or healthier ways, more natural ways to deal with a lot of the symptoms or physiological issues they may have. Contraindications with other medications is always an issue. And we need to know what medications you're on to be sure that there aren't any complications. And this is not static. One of the beautiful things about BioTE is that they have a whole army of scientists, physicians, PhDs, etc., who are constantly looking at these things, because there may be contraindications that are just now we're becoming aware of. Again, that's a constantly changing landscape. And what I can tell you is that we have confidence that when we put your data into the system with whatever medications you're on, the system is totally up to date, sharp as a tack, and looking at things that could be contraindicated, and it'll spit it back to us right away if there's something that the huge database has found that could be an issue.
Absolutely. What if I am already on another form of HRT?
Well, then there is a transitional period. There are people for sure that are already doing some kind of HRT, and they would like to switch over to the BioT system. And there's a transition period where, depending on what you're on and how recent you've had it, again, the system will tell us when is the right time to introduce to your body the BioT system. And you'll go through exactly the same process of looking at your blood and doing the analysis of your symptoms, and then the transition can occur very, very gracefully in a seamless sort of way.
Great. And the last one that we have at this moment is HRT covered by a spending account or a HRA? I think they mean HSA.
Right. HSA is absolutely.
Yeah.
If you have an HSA account, that's your money. You can spend it in the doctor's office any way you want. So have at it. And for many of you who have HSA systems, they don't turn over. What's that called? To roll over. They don't roll over to the next year. So if you got some left in your account, you want to use it up, especially if it doesn't roll over to the next year.
One last question from me is, if a patient was interested in hearing more, what would be the best way to move forward?
Just call us up.
Call you up.
Yeah, we have patient educators on the phone all day long, and if you would like to speak to either me or Dr. Pien specifically about this, when you call in to the patient educator, her name is Tracy. She's fantastic on the phone. She'll set up a consultation. You don't even have to come in. We can do it over the phone. We're happy to do it.
Once you get your lab results, we'll go over with you exactly what your body needs.
Last but not least, people wonder sometimes about the expense of this. To the extent that we have more and more patients coming in for this, for sure, at $500 for a 15-20 minute, or for men it takes longer to insert these pellets, we will have a full-time nurse practitioner who does this with alacrity and skill, because that's all she's doing all day long to get this done for you. It ends up being an incredibly good investment for you to do this. And depending on the kind of insurance you may be using for other kinds of hormone replacement, it ends up not being any more expensive than the other way, except the insurance isn't paying for it. And the results are extraordinary. Alice and I decided to do this not because it's a moneymaker for us. It truly is not. We're doing it because it is essential for your well-being and for your happiness. And quite frankly, we want happy people walking into our office. So we really hope you take advantage of it.
Absolutely. And one more question popped up, and that is, does your office perform the required labs?
Well, no, the labs, we'll give you the paperwork, and you can take the paperwork to any lab like LabCorp or any other system out there. LabCorp is the most pervasive of all the labs. They're like Starbucks, they're everywhere, like weeds. And your insurance, if you have insurance, will cover the lab work for sure. All the insurance systems do. And if you don't have insurance, we have a special relationship with LabCorp where it only costs $100 to get this done. But we don't draw the blood in the office. You have to go to LabCorp to do it.
I would also add to everyone on the call that this panel, if you were to just go into LabCorp and try to get this panel done, a cash price is, I've seen it up to $1,500. And so the opportunity for a cash price of $100 is pretty incredible.
And that's, by the way, just another thing that BioT has negotiated on our behalf. It's BioT that established this relationship with LabCorp so that you can get this test done, this panel done so inexpensively.
Excellent. And with that, I will thank everyone for joining the call. We appreciate your time. I'm sure you enjoyed it and learned a lot. I will also add that this has been recorded, and so you will have the opportunity, if you would like a recorded version, please let the office know and we will be able to send that out to you. And if there's nothing more, I will say good night. Thank you so much.
Good night, everybody. Merry Christmas. Happy New Year. Happy Hanukkah.
Happy holidays.
Bye.
Thanks. Bye.